Welcome to Stat, I'm telling you all medical true crime stories, and it gets bizarre. Karen Wickham, yeah, she used to work in ER, and now she's sharing the knowledge, so let's get involved. Hey, funny and scary at the same time. Medical mysteries, all facts, she ain't lying. So tune in to Stat if you dare, cause crazy things can happen anytime, anywhere. Yeah.
Hello, 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 everybody out there in podcast land. Welcome to Stat, Shocking Traumas and Treatments, and I am your host, Karen Wickham, coming to you from beautiful Toronto, Ontario, Canada. What happened to my voice there?
I don't know.
Got all froggy.
Froggy. You got a frog in your throat? Ribbit.
Ribbit. Well, I am, I've got some French in me. Can I say that? That's what she said.
Oh, God.
Okay, so let's talk about today's episode. We're going to do, as you probably read in the title and show notes, this is now going to be a mini-series about women's health. And why is the women's health a mini-series and the men's health one episode? Well, because we have a lot of extra internal doings.
And, because we're complicated. That's just it.
We make babies.
Yeah.
Well, not alone.
Of course.
But we grow babies. That's
yes.
That's better. So we have more internal,
nurture them. Yes.
exactly, things going on. So this is going to be a couple of episodes long, and I really hope that you guys get something out of it. I think it's important to talk about our bodies, our reproductive system, and I'm not going to assume that everybody that's listened or that listens is like, oh yeah, I know my body inside and out, up and down. There may be people listening that don't understand the female reproductive system and how it works. And I think we should all be open to always understanding and to learning. And sometimes it's embarrassing to want to ask these questions. You know what I mean? So,
yeah.
And some of this stuff just kind of doesn't come up anymore, but it's still relevant. And you'll see what I'm talking about. For instance, toxic shock syndrome. That's something that was huge in the 70s and 80s. There was a lot of things going where women were becoming quite sick. So, but it's still relevant. So yeah, let's just get into it. Let's talk about the female reproductive system. So the way I've worked it out, I'm trying to think, where do I start with this? So I'm going to start from the bottom and move on to the top. Is that a Jenga, woman's Jenga.
Oh, God. You know commercial ads that I don't even...
Jenga, Baba Jenga.
Oh, God.
Okay, so we're going to start with the vagina. Cervix, which is the lowest part of the uterus. And then we're going to talk about the uterus, and we're going to talk about the fallopian tubes and the ovaries, and we're going to talk about breasts, and we're going to talk about, the uterus is a huge organ, and there's a lot that goes on there.
Well, I mean, in physical size, it's not really that large, but it's miraculous what it can do.
Yeah, like in my head, I see the uterus taking up half my abdomen, but then again, I had a large baby, or I was very large, so I'm like, okay, my uterus is half my body, but yeah, and that's incredible about it. So what I want to also touch on, which I will start to in this episode, is menstruation, pregnancy, all the aspects of pregnancy, including things like prenatal care, postnatal care, postpartum depression, or postpartum care, postpartum depression, postpartum psychosis, and things like that. And we're also going to talk about menopause. So that's how things are going to break down, and we'll see how this goes. I haven't decided whether this is going to be a 2 or 3-parter, but I'm pretty sure it's going to be 3-parter. Anyway, okay, so let's start with the vagina. And again, I'm going to cover anatomy of things because I'm just going to. Why not? What is a vagina for?
Birth canal.
Getting pregnant. Pretty much is its biggest thing.
I guess those are the two main things. Right?
Yeah, to get the baby in there, sort of. I know that's not how, whatever. And it's to create the baby. To create the entranceway, to create a human being and a way of getting that thing out of you. Because by the time You're ready. You're ready.
Mm-hmm.
We'll also talk about C-sections because that's important. Okay. So what are some things that can affect the vagina negatively? What are some problems that we can have? And one of the top ones to talk about is sex. Okay. Like I said, there's various things that can affect the health of the vagina. And so when you think about sex, there's certain things like unprotected sex and forceful sex, injury to the pelvic area. And then something else we can touch on is sexual abuse and rape, and how obviously that affects your body physically and most importantly psychologically. There are certain health conditions that occur that are related to the vagina, but the other organs of the reproductive system, such as endometriosis and pelvic inflammatory disease, which I'll refer to as PID. You can also get scarring from pelvic surgery, and certain cancer treatments can also cause painful sex. So, like I said, this is all relating to sex. So you have those conditions that's going to create a lot of pain and bleeding. So one of the things that can upset the normal flora or upset the incredible balance of how the vagina keeps itself from getting sick, so to speak, from getting infections and things, are what we put in it or around it. And one of them is barrier creams. Something that can, just help with birth control. Or if you have, you're feeling uncomfortable down there, that kind of stuff, a barrier cream can throw everything off. Because really nothing is supposed to be there. The vagina can just take care of itself. And you're not supposed to really, it isn't supposed to really need help with things. So you don't really need to help it along unless something's going on. Condoms. Some people are allergic to condoms, or the
latex or the lubricants if they're, whatever.
Exactly. Diaphragms. I don't even know if they're really being used anymore.
Oh yeah, I've got quite a few clients that will tell me they have, because I always, when I do an intake, if a woman's presenting with low back pain, I'm always asking about C-section scars and endometriosis and stuff, because of course that can refer to the low back. So
okay, yeah.
And sometimes, I guess for some women they work okay, but for some I'm wondering if they do exacerbate some symptoms more than help. But it's all individual, right?
Oh yeah, 100%. Another one is spermicide.
I guess, sorry, I should have said like IUDs. Was that what you meant?
Oh, no, diaphragms.
Oh, okay.
IUDs are different. Diaphragms are they look like little cups.
Sorry, I had IUD in my head. That's what I was thinking of.
Oh, okay. Well, that's what I'm saying. But, okay, we got that cleared up. So I'm thinking, all right, there's still a lot of diaphragms out there, but all right. We will get into some discussion about IUDs.
Okay.
Spermicide and sprays and deodorants and douches. A lot of women douche, and you don't need to. If there's something going on down there that doesn't seem right, you should see your doctor. And sprays and stuff like that. If you're having unpleasant odors and discomfort and stuff like that, a douche is not going to clear it up. It may make it worse. Same with deodorants and stuff like that, sprays and all that kind of stuff. We just need all natural. So if you're going to use a wipe, that kind of thing, just something that has no perfume on it, something that won't clear away the normal bacteria and yeast that we have in there. We want that to do its job.
It's a delicate balance.
Yeah. And so another thing that really obviously affects the vagina is childbirth and pregnancy. You can get vaginal tears, episiotomy, and just from pregnancy, decreased muscle tone in the pelvic floor. So some women nowadays prefer or ask for a C-section over and above there being a medical reason for it. Just because a lot of trauma can go on down there. I can speak for that. I had a grade 3 tear.
Oh.
Yeah, and I'm telling you,
ouch.
I went from 0 to giving birth. My doctor went grocery shopping. I was quite young, and he was just like, It was 11 o'clock in the morning. I've been in labor. I didn't know. I felt constipated. I went to the bathroom and I'm like, I think there's something more to this. I was by myself, honestly, up north, a long way from many people. I don't know what I was thinking. I'm going to do this at home. I'm going to be that mother swaddling her child, naked with a gauze blanket covering us and, like the Madonna and the baby. No. I was like, someone get here now. Anyway, yeah. He's like, first birth, blah, blah, blah. Walking around. No, I called the nurse. I'm like, I'm in a lot of pain. She's like, just go walk around. And I'm like, oh, God, it hurts. And then I felt stickiness. And I said, can you come take a look? And she's like, oh, my God. So by 1 o'clock, Van was delivered.
So much for, well, because sometimes they say for first birth, they're like, first birth, women are in labor for a while and yada, yada.
So between 11, them sort of giving me shit for being a wuss, walking around. Mm-hmm. So they called my doctor, but the nurse is pretty much delivered, Van. And because I was just like, get it out. And I didn't get a lot of support. And that's why I got some, some damage and tearing and stuff like that. But it was all worth it. He's the
wonderful, wonderful young man.
An important part of the universe. Mm-hmm. Okay, so psychological issues can affect sex as well. Anxiety, depression decreases your arousal. And if you still feel like you want to be intimate or be intimate with your partner, that can cause a lot of pain because you're just not ready to have sex. Your body's hasn't lubricated itself properly. So it's going to hurt, or it may hurt. Hormone levels. So changes in estrogen, the decrease of estrogen. As we know, it declines during menopause, but it also declines during breastfeeding. Okay? And it causes the vaginal lining to thin. It's also known as vaginal atrophy, making sex very painful. So the most common problems with the vagina are sort of like what I was just going through, pain. And it's also known as dysmenorrhea. And it can be caused by, over and above the things I just talked about, spasms in the vaginal wall. And then we talked about vaginal dryness post-menopause. STDs, huge one. Chlamydia, gonorrhea, genital warts, syphilis, genital herpes. And these may present themselves with abnormal discharge and sores and abdominal pain. Another one is vaginitis. So that's the change in the pH balance of the yeast and the bacteria that are in there. And like I said before, so much can throw that off. The human body is incredible. All of it. So it's down there going, listen, you don't need to be doing that. Just let me do my thing. Step away. Step away from me.
You and your voices. I think the important thing is just the body always wants to be in a state of balance or homeostasis. It always wants to go back to the set point. And then just sometimes things can upset that, whether it's, introduction of foreign bacteria or...
Yeah, just everything that we...
Sexually transmitted infection,
Well, and so with vaginitis, and this is a pretty common thing with women. And again, there's this stigma and sometimes shame related to it when it's just something that can happen. So you may get abnormal vaginal discharge that has a strong odor to it, unpleasant odor to it, itching and pain. And common types of vaginitis are bacterial vaginosis and yeast infections and I always have a hard time saying that, trichomoniasis. That wasn't too bad.
Yeah, that's not an easy one.
Okay, so then you also have something called a pelvic floor relaxation. The connective tissues and ligaments that hold the uterus and vagina become weak and may lead to prolapse. You can have vaginal cysts that are benign but may cause bleeding during sex. And then you have vaginal cancer. So at the beginning, early stages of it, it affects the cells in the lining of the vagina and can be completely asymptomatic. Only when it becomes more invasive and spread to nearby tissues and deeper into the walls of the vagina that you start to really get symptoms like abnormal vaginal bleeding, abnormal discharge. You can feel a mass or a lump and have painful sex. The difference between a lump or a mass and prolapse is that a prolapse is really mobile. You know, I've seen it where women have a prolapsed uterus, and you can just kind of push it right back, or you can have a rectocele, that kind of thing. Always get it checked out. Always get it checked out. Then in advanced cancer, vaginal cancer, you have all of the above plus painful urination, constipation, pain in the pelvic floor or lower down in the belly, back pain and swelling in the legs. And yeah, it's...
Now for those who may not know, a rectocele...
Oh, is sort of a weakness in a wall. A rectocele is when you have a weakness between the bowel and the vaginal wall.
Okay.
And what happens is that the bowel will pouch into the vagina and can actually go into the vagina itself and sometimes actually prolapse out. And that can be treated surgically, but it becomes problems when it comes to passing stool and stuff like that, because it can sort of get stuck in that area. And it, again, see the doctor about it, and there are some options for treatment for those things. So
it's, I mean, I've had, many clients who've, had difficult, challenging births and stuff. And usually it's mostly like their bladder is kind of, if they cough or sneeze and stuff from
urinary incontinence.
Yeah. From just, but I guess that's more related to uterus and stuff.
Yeah. And I mean, I think, again, if you're having some of these things, go see your doctor. Mm-hmm. They may say, hey, you know what? It's this, or it may go, you know what, this is more concerning, let's do some tests. And it's better to catch like any of this early on. Unfortunately, some things are asymptomatic, and, that's why regular checkups are really important. I mean, we don't want to go see our gynecologist. We don't want to be, hi, hello, how are you, on the table in stirrups. But honestly... And some of us have suffered some very serious trauma, and it's very difficult. And that's important to find the right doctor to do this. But please don't avoid getting your checkups, because, like I just said, you may be asymptomatic to something that will, reveal itself. So if you start to get symptoms in general of discharge changes, redness, itching, bleeding, feeling a mass or a bulge, and having painful sex outside of normal, or something that's explainable, go see your doctor, outside of going to see your doctor regularly. Okay.
Yeah, and there's also, lots of options now for women who have, maybe sort of more minor issues like urinary incontinence or vaginal prolapse or whatever. Is pelvic floor physiotherapy is really huge now, and there's a lot of really great practitioners out there that can help you and can make a great improvement in your quality of life.
Yeah, so that's definitely another option you can look into. I think you should always go to the doctor first.
Yes.
Get a diagnosis. They would
refer you, yeah. Mm-hmm.
And then often, but I've seen more and more, or heard more and more doctors are referring and saying, hey, you can go get some physiotherapy for that, etc. Mm-hmm. Okay, so it's time to move on to the cervix. The cervix connects the vagina to the uterus, and it's a muscular tissue. It kind of looks like a donut. Okay, so I'm going to break down the cervix. There's two main portions. The ectocervix, and there's an opening in the center of it, also known as the external os. It allows a passage between the uterus and the vagina, because that's where we need the swimmers to go up so that we can get pregnant. And, baby's got to come out too. And you've got the endocervix, which is the canal. And this is this little 2-inch tunnel that goes through the cervix up into the uterus, but it is the furthest part of the uterus itself. And that little what are you shaking your head at?
2 inches, and then you got to give birth to like a 7-pound baby or something. Like
I didn't know what you were shaking your head at.
Just like, it's miraculous, but also, ow.
Yeah. So that little 2 inches is called the transformation zone.
No doubt.
Yeah. Okay, so let's talk about conditions of the cervix. So you have cervical cancer, which is mostly caused by HPV. And we're going to get into HPV. You're going to teach you guys about it today if you don't know. And if you do, I think it's important to, review it ourselves again. Mm-hmm. And that can be easily diagnosed through a pap smear. So get your regular pap smears, ladies. Cervical incompetence, which I didn't know about. And it's the early dilation during pregnancy, which can cause a premature delivery, premature baby. And it's usually caused by prior tests or trauma. So you might have had a procedure done that has, where you had to go up into the cervix and into the uterus, and it could have caused some damage to the muscle tissue and things like that. So, and then you have cervicitis, which is an inflammation of the cervix. And again, we're looking at that's caused by an STD, we'll say for the most part. You never know. The body can always have that tiny, tiny percentage is caused by something else. Another one is cervical dysplasia. Now, this is really important. These are the abnormal cells that can be found in the cervix that can turn into cervical cancer. So if that is caught early, there is a huge chance of stopping cancer to progress. Another thing is cervical polyps. These are small, painless growths that are usually harmless and cause vaginal bleeding. So now I want to get into pelvic inflammatory disease, and I'm going to refer to it as PID from this point on, because then I won't mess with saying things so I don't fall all over the words. Okay, so it is an infection of the reproductive system, female reproductive system, and it's usually caused by an STD. And it starts in the vagina and can work its way up into the uterus, fallopian tubes, and even towards the ovaries. The symptoms sometimes can be mild to difficult to diagnose because it's just lower abdominal pain. Could it be a painful period or uncomfortable period? Could it be constipation? Any number of things. So the symptoms early on, like I said, are mild to difficult to diagnose. And some women don't even know that they have an STD until it's advanced along. From there, the pain can be anywhere from mild to severe, and it's in the lower abdomen and pelvis area. You may have abnormal and heavy vaginal discharge that doesn't smell good at all, and abnormal abdominal bleeding, especially during or after intercourse and in between periods. Painful intercourse, and some women will, as it advances, get fever and chills, and painful, frequent, and difficult urination. If you get to that point, this is a medical emergency, okay? Go see your doctor. If you have severe pain in the lower abdomen, nausea, vomiting, fever over 101 or 38.3, and foul vaginal discharge, okay? You could have an abscess in there that has ruptured. Mm-hmm. And then that leads to peritonitis. And you get very, very sick. You can become septic. And you may lose the ability to have children in the future. So go to the doctor.
Don't ignore things.
So the causes. STDs. Most common, gonorrhea and chlamydia. Menstruation, after childbirth, miscarriage, or abortion. IUDs, and a pap smear biopsy. Because you're opening up that area, you're irritating that area, it's entering into the reproductive system. So the risk factors to PID are usually sexually active females under the age of 25, being with someone who has been with multiple partners, sex without a condom, overdouching, and a history of PID or STDs. So these are all your risk factors. Complications of having PID. One of the main complications is ectopic pregnancy. PID is one of the major causes of it. So an untreated infection, PID, can cause scars in the fallopian tubes. The scar tissue prevents the fertilized egg from making its way through the fallopian tube to implant in the uterus. And then the egg implants into the fallopian tube. This is a medical emergency because you can get massive hemorrhaging. Another complication is infertility. The reproductive organs become infertile because a person can't get pregnant because, for instance, scarring in the fallopian tubes. And each PID infection increases the risk of infertility. Chronic pelvic pain is another one. And this pain can last for months or years. And scarring in the fallopian tubes and pelvic organs can cause pain during intercourse and ovulation. Another one is tubo-ovarian abscess in the fallopian tubes, in the fallopian tubes and ovaries. And untreated, like I said, it could burst and lead to peritonitis. So prevention, safe sex, use a condom. Basically, the only way of never getting PID or an PID infection is to never have sex.
Yes, I was going to say abstinence.
So I wonder how many nuns.
Oh no, don't go there.
Just leave it?
Yeah.
So get tested for STDs, and early treatment reduces the risk of serious complications. And you can ask your partner to get tested if, you're serious about each other, or just because the person is a decent person, you can say, hey, can you get tested? Or can you show me tests? That's a choice that you can have. And I don't think it hurts to ask.
Yeah, just be smart, have protected sex if you're gonna be sexually active.
Yeah. And don't douche. Don't douche. Unless your doctor says to do it and has a good reason for it, don't mess what is already perfect. Okay, so let's talk about HPV. Let's talk about HPV. Let's talk about human papillomavirus. Okay, it's viral and it causes skin and mucous membrane growths and warts. There are 100 varieties of HPV. I had no idea.
That's crazy.
Yeah. And some cause warts and some lead to cancer. And the main cancer it can lead to is cervical cancer. But in rare cases, it can cause anal, vaginal, vulval, penis, and throat cancer. And it's transferred from sex, skin to skin contact. So symptoms of warts. In genital warts, they're flat lesions or small cauliflower-like bumps or that have stem-like protrusions. Women, you will see it in the vulva, cervix, and anus, and men, you will see it in the penis, scrotum, and anus. Most common warts that you see that are aside from the genital HPV are your ones on your hands and fingers, and then you can have them on your heels and your feet, and flat warts can appear anywhere. So they're contagious. Okay? And so I want to talk again about cervical cancer. So nearly all cervical cancers are caused by HPV, and it can take up to 20 years to develop and have absolutely no symptoms. So this is kind of like the rule of thumb for women being screened. Between 21 to 29 years old, a woman should get a pap smear every 3 years. And you can also get a HPV DNA test, just, to see if you've had a prior infection. And then women from 30 to 65, they recommend every 3 to 5 years. So every 3 years if you haven't had a HPV DNA test, and every 5 years if you have. Again, that's up to you and your doctor. Pregnancy. This is really important. If the pregnant mother has HPV, the baby can get infected during delivery. And these growth warts can end up in their larynx. Okay?
That's scary.
You don't want to pass that on to your baby. You don't want to have it at all. And if it happens, it's not because someone is, they may not even know. But it's incredibly serious.
Over 100 of them, right? And it's...
Yeah.
Right.
So I think the risk factors are pretty obvious, but let's go through them anyway. The number of sexual partners someone has had. Their age. Again, genital warts most often occur in teens and young adults. Weakened immune systems in people taking immune suppressing drugs. And one of them can be, example, if you're HIV. Damaged skin in the area and just personal contact, skin to skin. Complications. You can get oral and upper respiratory lesions and cancer. So let's talk about HPV vaccines.
Yes, they've definitely been increasingly, in the last, 10 years or so,
or more.
There's there's been a push to vaccinate young people to prevent cervical cancer, right?
And there are a lot of, how do I put this delicately? Religious folks that are against this.
Well, because they want abstinence, but that doesn't protect you from...
Did you know they've done tests or they've run studies that getting an HPV an HPV vaccine does not actually increase sexual activity. It's a prevention. Okay, so one of the vaccines is Gardasil 9. It protects males and females against cancer and warts. It's recommended that these routine HPV vaccines for girls and boys start at 11 and 12 and can be given as young as 9 years old. Again, they hear this and they go, oh my God. But the fact is that you're starting a preventative measure so your body can build up an immunity. This is not giving permission for a 9-year-old to have sex. It's saying, let's protect them for the future.
And even if you have this vaccine, when you get older and you start being sexually active, it doesn't mean you should not use protection still.
No, because you've got all other different STDs and like what we already talked about before, things that can happen. And so basically what they're saying, they should get this vaccine before they become sexually active. And the dose is 2 doses of the vaccine 6 months apart, and then a second series between the ages of 15 and 26, and they get 3 doses. Okay, so that's it for the cervix for now, and talking a little bit about HPV. Let's move on to the uterus. This is a big one. And I'm only going to be able to talk a little bit about the uterus today, and we'll pick up. And there might be an entire episode just related to the uterus on the next episode. But let's talk about the uterus. The things that I'm going to go through, I'm just going to list them right away, are periods, or menstruation, prolapse, retroverted uterus, congenital uterine malformation, polyps, fibroids, endometrial hyperplasia, endometriosis, uterine scars, Asherman syndrome, chronic pelvic pain, cancer, pregnancy, menopause. It's huge.
Mm-hmm. Lots to cover.
So I'm going to give a little bit of an anatomy lesson here. It was a good review for me on some things. I'm like, oh yeah, that's right. So, hopefully this won't bore the hell out of you guys, but I don't think it ever hurts to really listen. Again, and there may be some of you guys listening that males or females, I say guys a lot, some people don't like it. For those that are listening, you may not know a lot about this. So, here we go. Often referred to as the womb. It's a pear-shaped organ in the pelvis. One of its many, I don't want to say uses, jobs, is to fertilize the egg.
Functions.
Yeah, functions. The implantation of an embryo and the development of a baby. A baby. It's a muscular organ. It stretches exponentially to accommodate a growing fetus or fetuses.
Yes. Multiples.
Like twins. Yeah. Triplets. Or, what was that? How many did that one woman have? 9?
9. I don't know. There's the Dion quintuplets.
Yeah, no, but there's some. Well, that Karen show, she had 8. Kate and 8. No, did she have 6? She's like the original Karen.
Oh God.
I think she had 6. It was Kate and 8 or something like that, and I think she already had. I don't know. I didn't really watch it, but still, anything over 2 or 1, that sucker's stretching out. Mm-hmm. So it contracts to push the baby out during childbirth. The lining of the uterus has 3 components. Okay? And let's talk about them. You've got the perimetrium, which is the outer layer made up of epithelial cells. And then you got the myometrium, muscle. It's the middle layer made of smooth muscle tissue. And then you've got the endometrium, which is the inner lining that builds up over the month and is shed if pregnancy doesn't occur. And then there are 4 main sections of the uterus. So that's sort of like a cross-section of it from outside to inside. Now this is actually from top to bottom. You have the fundus, which is the widest portion of the organ that connects to the fallopian tubes. If you've ever seen my angry uterus picture, it's the arms that are in the air that go, that's pulling out the uterus hair going, why? Why do you have to be such a jerk sometimes? And then you have the corpus, which is the main part, and it starts directly below the level of the fallopian tubes and continues downwards, becoming increasingly narrow. And then the isthmus, I can never say that properly.
You did good, isthmus.
Did I? Okay. Is the lower part of the uterus, and then the cervix, which is the lowest 2 inches of the uterus.
Isthmus is like the narrowest part of something usually, like a peninsula or something.
Oh, there we go. So I just learned something. Yeah. Isthmus. That's what isthmus is.
Was on Isthmus.
Merry Isthmus. Merry Isthmus. What's that one with by the waitresses?
Merry Christmas.
Merry Isthmus. Merry Isthmus.
I always forget the title of that song.
Okay, so now let's talk about conditions that can affect the uterus. Now, we're going to start with the menstrual cycle. That's a normal thing. I'm going to break down how it works. First half of the cycle, you have an increase in estrogen that makes the lining of the uterus grow and thicken. And then the follicular stimulating or follicle stimulating hormone kicks in, and an egg from one of the ovaries starts to mature. On day 14, the luteinizing hormone kicks in, and the egg leaves the ovary. And this is when ovulation takes place. And then you have the second half. So the egg travels through the fallopian tubes into the uterus, and your progesterone levels go up, and they help prepare the uterus lining for pregnancy. And then one of 2 things happens. The egg is fertilized and attaches to the uterine wall, or if not fertilized, it is absorbed back into the body. And at that point, your estrogen and progesterone levels drop, and the thickened lining of the uterus is shed. And this is called the menstruation period. Okay? A normal period usually lasts 3 to 5 days on the average, but it can happen up to 7. You get a moderate flow. You might get some mild cramping and bloating, maybe some headaches, your mild symptoms related to it. But in the early years, when the period first starts, it starts usually around between 12 and 15 years old, but can start as early as 8 and as late as 16. Now, I was 10.
I was a late bloomer.
When did you have yours?
I was 16 almost.
Really?
Mm. I might have been 16, yeah.
Because I had mine at 10. For me, it was mortifying. I remember seeing some, little hairs starting to grow in, and I would pluck them out. And I think, that was it. All right, it's done. I'm finished with this. And then started getting boobs, and they've been growing for the last 41 years.
Oh, goodness. Things we endure as women. Yes, but some women don't have normal periods, of course. So,
but early on, so when your periods first start, and then into menopause, they can be irregular. So the first thing to discuss is amenorrhea, which is you have no cycle by the age of 16. So that's definitely needs to be checked into. It could be
I had a client
hormonal.
who has that. It's I forget the name of it. But basically her uterus is like she can't have children. Like she never.
And that affected her, that she didn't start her period?
Yeah, she never. It's a specific condition. I just can't remember the name of it. But
we'll see if it comes up. I can't think of a name. I can't think of a thing right now either. And then no periods in women that used to have regular periods. And these are some of the causes. Well, pregnancy, obviously. But you know what? That's not obviously.
Yeah, because some women will have.
That was a shitty thing for me to say. Because you can be pregnant and not realize it. Or not be, and then all of a sudden you're like, I missed my period. I need to get a test.
Mm-hmm.
Okay.
Yeah, but some women also they'll get bleeding still during, their pregnancy.
Yeah, but not like you would with your regular period.
Mm-hmm.
Breastfeeding, excessive exercising, stress, extreme weight loss caused by illness or an eating disorder, hormonal problems like the pituitary, thyroid, ovary, and adrenal glands. So yes, those things. So I'm wondering if this person you're talking about had some problems with those that didn't, maybe it was a structural problem, or maybe it was a hormonal problem.
No, it's a structural thing specifically. But I mean, I've also had clients who've had their periods affected from concussions.
Wow.
Like a head injury that affected, because the blow affected pituitary.
So these are things sort of like on the periphery that I would never think of that I'm going to want to look into a little bit more.
Of course, when they got some treatment for their concussion, it
started again.
It started again. Yeah.
Okay, and you've got dysmenorrhea, which are painful periods. And we're talking severe pain here. And usually this is caused by an excess of the hormone prostaglandin. And also can be caused by fibroids and endometriosis.
Yep. Fibroids, I guess, can cause a lot of heavy bleeding too.
Oh, yeah. And incredibly painful periods.
Mm-hmm.
And the next is menorrhagia, which is abnormal uterine bleeding. You get excessive bleeding, long periods, or short periods between. So you may have a period for 12 days, 3 days off, and then start right back at it again. And this can be caused by fibroids, polyps, or something more serious.
Mm-hmm.
So when do you see a doctor? So if you haven't had your period, or your child hasn't had their periods by the age of 16, take them in, maybe even sooner. Or it's just suddenly stopped, or bleeding more than usual, or bleeding excessively, or you are suddenly sick after using tampons. And that leads me into talking about toxic shock syndrome. You don't hear about it a lot, but it's still a really, it's relevant. Maybe it's a condition that can still happen, and it's incredibly serious. Okay? So let's talk about it. Just because it's not talked about a lot anymore, I think we should talk about it because it's something that could come up. So, certain bacterial infections release toxins into the bloodstream, and these toxins spread into the body and cause severe damage and illness. And the bugs are usually Staphylococcus aureus, Staphylococcus pyogenes. I always say it wrong. And Clostridium sordelli. Okay. If you get a sudden high fever, muscle aches, diarrhea, dizziness, fainting, sunburn like rash, sore throat, bloodshot eyes, headache, decreased liver function, decreased urine output, disorientation, confusion, tachycardia, or like a group of these together, get to the doctor.
That's a lot of symptoms.
Well, they actually vary depending on the strain.
Right.
Depending on the bug. But even so, you will get a whole bunch of these. Some may be a little different from others. Now, it was really prevalent in the 70s and 80s because of the introduction of highly absorbent tampons. So they were just creating this problem. And so into the 80s, they changed how they made their the tampons, what was in them, the contents of the tampons, that kind of stuff. So this is dramatically dropped off. But there's still a risk, and it's not just from tampons. So super absorbent tampons, surgical wounds, local infections, a history of using a diaphragm or a sponge, or recent childbirth, miscarriage, or abortion. And it's diagnosed with blood cultures, blood tests, urine tests, and lumbar puncture.
What about those the Diva cups that some women use as opposed to tampons?
What I understand about them, because I'm so far away from my period, I had a hysterectomy when I was 37. So my understanding is that you put them in, it collects the blood, and you empty it, clean it, and put it back in again. So I don't know.
Yeah,
maybe
I mean,
you can tell us a little bit more, anybody who uses a Diva cup, if you feel comfortable, or if you know more than I do. I feel kind of silly for not knowing about it.
Well, I know they're usually like a hygienic silicone type of a material. And I mean, unless you had, an allergies to that, maybe it would be more or less. Sorry, more.
Well, I mean, it's more environmentally friendly, and you're not putting something foreign into your body that can leach, a toxin out of it. It's collecting and then
absorbing.
Okay, so treatment. This is so serious. These are some of the treatments you might have to get, because you can go into organ failure from this, like absolute shock, like it's called, and sepsis, right? So it depends on the extent of the disease, but usually a woman will need IV antibiotics, IV fluid to treat the shock in the organ damage, medications for low blood pressure, dialysis. They may need to be ventilated, or supplemental oxygen, or deep surgical cleaning of the wound. So, again, it's rare now, but it still can happen. So if you have any of the things that we talked about that can cause it, whether you use a super absorbent tampon, like we said, surgical wounds, local infections, that kind of stuff, history of diaphragm or sponge use, just had a baby, miscarriage, abortion, these are your triggers that can cause it. So, or that can lead up to it. Okay, so I've decided to kind of stop there, because I'm pretty sure the next episode is going to be mostly on the uterus and things that occur with the uterus, and we'll carry on from there. And so I hope you guys get something out of this.
Yeah, I hope we educated you.
Yeah, and if you know that there's someone that could benefit from listening to this, please suggest it. And it's not about numbers. It's just about education. So if there's someone that you think can benefit about it, it would be great if you had them have a listen.
Yeah, and just one thing I wanted to add, because like I said, when I'm treating some women for low back or abdominal pain and stuff, I like to do a good sort of thorough intake about what's their periods like, what were they like when they started and stuff. And some women, they have really heavy, horrible, painful periods, and sometimes they just think that that's normal, like because everybody in their family, their moms was like that, their sisters was like that, or whatever, or they've always had that. Yeah, but it's not really that normal. I mean, like you said, a normal period shouldn't be, you having to take Percocets for the pain. I had a client once who took Percocets for period pain. And the reason why I had a hysterectomy was because I was having such severe pain and endometriosis, and I already had my boy, and the discussions had taken place whether I was going to have another child or not, because at that point he was 15 and I had been talking for a few years about having a brother or sister, and he's like, no, I want to be a single child. And it's not like he made the decision on it, but if your other child, I don't know, I just kind of was like, I can give him everything. I can focus on one child and, not have to worry financially about certain things. Not that, obviously I was looking at having another child and I loved them and made it work and that kind of stuff. But I thought, I can give it all to Van.
But, part if they're like, nope, I don't know. Some people think I'm crazy that I helped him let me dictate it, but it was a part of it, I don't know. I let it be a part of my decision.
Yeah, well, I mean.
And there would have been a huge difference in age.
Yes.
Because I was looking maybe when he was around 10 or 11, then I was like, okay. But then there would have been a 10-year difference, and that's a big deal. Mm-hmm. Anyway, let's carry on.
All right.
What was I talking about before this?
I think you were saying this was the end of the episode. Because there's so much to talk about the uterus.
I'm just going to end by saying that so the doctor and I discussed it, and I'm like, I'm not having any more kids. I'm done. And, he's like, all right then. And my quality of life improved exponentially.
I was just thinking that, like, it's just, for some women, they're anemic, they're bleeding, heavily, sometimes for 10, 12 days. And it's just, it's rotten. The
pain was so incredibly bad. Like, I didn't know what to do with myself. Like, I wanted to crawl out of my own body. And working while in so much pain, and then like actually considering taking time off for a period. And I know it's not just a period. That's, any woman that suffers can tell you that this is no little thing. Mm-hmm. If you had some other condition that was incredible pain like that, and you were asked to work through it, and it's not like you can take something heavy for it and then go to work. It's not like, like you said, have a Percocet and then show up at work, okay. But anyway, so it improved my quality of life, and I kept my ovaries, and I'm not in menopause at 51. So, it was worth it for me. Mm-hmm. So
it's very individual for each woman.
Yeah, but and also for some women, it's like I feel like they're losing part of their femininity, and losing their ability to have a baby is a big decision. Some women, it makes them feel like less like a female, like less like a woman, and that's something that's relevant. So yeah. Anyway, I hope that you guys enjoyed today's episode. I'm not going to do these episodes straight in a row, what I'm thinking of is doing one a month after this and get into another subject at the same time. And I'm gonna still the what do you call it? The something is out. The jury is out. On this one, but I think I'd like to continue because this is maybe a very get into 2 and 3 or more episodes. We're going to talk about something else in between, if that makes any sense to you. What I just said with my rambling, Mary's eyes went all googly in different directions. Me trying to explain this.
Maybe alternating. We're going to do women's health. I'm going to do some sort of serial killer, and then we do women's health. Yeah,
because they definitely go hand in hand. Jesus Christ. Could you have more opposite? Though, all joking aside, we've talked about like Andrea Yates and postpartum psychosis, and
Well, some women joke that they could use their PMS as a defense for murder. Husbands or partners, but anyway.
Yeah. Okay, so we digress. At least I digress. So I hope, like I said, I hope this has helped, and I really appreciate you guys listening today. If you have any questions or anything to add, please drop me a line. All the ways to contact me are in the show notes. And if you're on the Facebook page, just jump in and let's have a discussion about this. And I hope you guys are all doing well and taking care of yourselves, taking care of each other. And most important, love yourself.
Peace.
One love.
True crime and it gets none realer. Sometimes it'll be the cure that'll kill you. Gotta watch out, yeah, you gotta watch your back, cause you don't wanna be another episode on Stat. Thank you for tuning in, learn a thing or two. These medical mysteries can be unbelievable. Yeah, subscribe, make sure you do that so you'll be tuned in and be ready for the next show. Stat.